and thank you for joining us. Today we're going to talk about aquatic therapies offered here at Meadville Medical Center, and joining us we have Mark and Stacey. Mark, Stacey, thank you for joining us. Before we get started, tell us a little bit about yourselves and your title here at Meadville Medical Center. Mark, we'll start with you.
My name's Mark Ray. I've been here for almost 22 years, and Stacey and another PT started the aquatic program, and I kind of joined about 6 months later or so when it really started getting rolling. But I do a lot of aquatic therapy, also just on land, as we call it, helping people out whatever they need.
Stacey?
Yeah, I'm Stacey Lantz. I've worked here for about 19 years. And yes, Amy and I began the aquatic program about 15 years ago. We started it, and it's just grown from there. We went from one pool to two pools. And
Wow. So let's start with just physical therapy as a whole. Kind of just recap the services that are offered here at Meadville Medical Center, and then how the aquatic part plays a role in patients' therapy. Mark, I don't know if you want to tackle some of that.
Yeah, I tell a lot of people that PT is from birth to death. And that kind of sounds weird, but we literally have a pediatric therapist that sees, I just asked her the other day what her youngest patient was, and she said it was 9 days, I think. And then we see people in the geriatric population. I had a 90-year-old the other day. So it's literally, you name it. The neat thing about being here at Vernon is there are orthopedic surgeons upstairs. And so we see a lot of orthopedic patients, but that's not it. When we see stroke patients, just general back pain, I mean, you really name it and we're gonna see it.
And Stacey, it's not always something that applies to a patient after surgery, but physical therapy applies to a lot of things, just the everyday type of situations that
absolutely. We see people that just have chronic pain issues, so that we're trying to get them more functional and back to a more productive life and just feeling better and being able to walk or being able to go shopping or do things that they were previously unable to do and just wanting to get back to their normal life.
So you had a role in bringing aquatic therapies to Meadville. Talk about that process, and what were you seeing, studying that led you to say, I think we should do this here?
So when I worked prior to coming to the hospital, I did worked in an aquatic facility, and I saw a lot of benefit with that because you can do things in the pool that you can't do on land. So especially those patients that have that chronic pain, you can get into the water. It helps to unload and take the pressure off, and you can walk normally. It can help to relieve pressure and allow you to move more and be able to strengthen where exercises on land may be more painful. And we just kind of started developing that program. So Amy and I, we did research into it. We went to different studies. Mark and I continue to do education to learn more techniques to use within the water and how to transition that to make life more functional.
Mark, it wasn't just one of those things for you where astronauts train in the pool, so this is cool, but there are several applications for this, and as Stacey was saying, a lot of reasons to get a patient into the water.
Absolutely, yeah. We see a lot of non-weight-bearing patients that have had ankle surgeries, and they are not allowed to weight bear on their foot. But since the water unweights them, we can get them in the pools because there are treadmills in the water, and we can get them walking weeks earlier and actually help them build up their leg muscle and their balance before they even can start land therapy. Yeah.
Stacey, what's the process of getting to the aquatic side of it? Obviously, you're probably looking at the patient, talking to the doctor, and figuring, okay, what techniques do we need to apply here, and then does aquatic therapies fit in with that?
Yes, part of that is coming from the doctor. We have to have a script to designate it for aquatic therapy. Now, when the therapist does an evaluation, they can see what their issues are, and if they've tried land therapy before and that wasn't beneficial, or if they're having too much pain, then they can suggest that we address it with aquatic therapy.
Yeah, sometimes they'll start with land, And again, maybe like a chronic back patient, and that is not working. And so the therapist will say, hey, let's try some water and let's go really gentle and see if we can get them back to a point where they can get back on land therapy. Because let's face it, water is a medium. It's not normal. It's not functional because we don't live in a water bubble. So to get them back to where they're strong enough or have at least a less pain so they can come back to land therapy and progress their program.
Are patients surprised at what's available within the water and maybe the accessories that you would use with a patient in the water? Because I'm sure there's things that they're doing on land, but once they get in the pool, maybe some of those things apply and maybe there's other things that apply.
Yeah, there's the first thing we usually hear is, oh, I can't believe it's so warm. So because it's about 95 degrees, we keep it warmer for those chronic pain people, the people that are really stiff. And then a lot of the exercises are somewhat the same, but with the what we call hydrostatic movement of the water, we can get 2 exercises out of one because there's resistance both ways. So, and then that's a lot more helpful in that point. Does that make sense?
Yeah.
Yeah.
And Stacey, maybe you can elaborate on that a little bit, and then also talk about just the success you've had with one pool. There's more than one pool.
Yeah, so, like you said, the hydrostatic pressure allows you to create resistance in multiple directions, and then our equipment we have can use that as well. So we're not using heavy weights, we're using paddles that use that water resistance. And the buoyancy of the water helps to unload those joints and allowing you to move more freely. Then, what was the next question?
Well, so, I mean, this is obviously a program that's been very successful, enough where you have, how many pools down there? 2?
We have 2.
2 pools.
Yeah.
So we started with one pool. It does have the treadmill, which is a big bonus for us. It just allows people to get to walking more naturally without that impact every step they take. And then as we progressed our programming, we found that deep well exercises were beneficial, where we have someone actually hanging from floats to allow all of that weight off of their joints. They could move more freely. So that's when we purchased our second pool. We got that pool with a deeper well so that we could do more completely unweighted exercises.
Mark, you go back 20 years ago and somebody was getting a knee done or hip done. They may have left the state to a warmer climate because they had some access to the pool in December, January.
Yes.
Stacey, it sounds like, again, you saw a need and we can do that here. Just the treatment over the last 20 years for patients in Northwest Pennsylvania, I mean, it has changed completely because of things like this.
Yeah, absolutely. Yeah, it's kind of like, what did we do before microwaves and cell phones? So this progresses, or this gives more advantage to the patient that they can get stronger faster or sooner, or at least be prepared enough to be able to start their land therapy in a way that we couldn't do before because we just didn't have the option.
So Stacey, I want to have you kind of break this down a little bit. I know we've talked a lot about maybe the people who would qualify for aquatic therapies, but we'll start with physical therapy. It's not, again, just something that happens after a surgery, but again, as you said, chronic pain. So just give us some of those things that somebody might be experiencing that they might need to think about making that phone call to get services that are offered here.
So really, if a person has any difficulties or challenges that have changed over time, as far as just their general mobility, their strength, their walking, lifting, those kind of things, pain, any of those changes just that affect your daily life, then therapy is something that you can do to help to improve those and be able to function more and be able to do what you want to do, as far as watch your grandchildren, being able to keep up with them, being able to climb the stairs, being able to carry your laundry, or go to Walmart and make it to the back of the store without needing assistance. Just if you need improvement in your quality of life, if there's things that are less available to you because of something that's holding you back. That's where we can help. We can help you regain some of those independence.
Mark, you want to add to that?
I think she did really well.
I know.
Yeah, I think when it comes to the aquatic side, not that you can't get a really good exercise program out of the water. A lot of people think, oh, when I get in the water, I'm going to splash around. No, and in fact, I have told many of my patients that balance when you're buoyant is sometimes even harder than being out on the land. So to be able to master being able to balance on one leg while you're kicking your leg, doing a leg exercise, that's actually better sometimes than being on land. So I really try to push that. Sometimes my patients don't like that because I will push them early, because I tell them if you can balance in the water when you're buoyant on one leg while you're doing something else, when you get out on the land, you're going to be way stronger than you thought you were.
And Stacey, along those lines, when it comes to working with a patient, are you in the pool with them, or are you outside telling them what to do? How's that work?
It depends on the person. A lot of times we are outside on the deck, and we're telling them, we're demonstrating from the deck so that they can see the motions and what we need to do. If there is a person that needs more assistance or has a fear of water, we will get into the water with them and help them progress that way as well.
Yeah, and we also have a lift. So if someone is truly wheelchair bound, we can literally lift them and drop them in the water. No, well, not drop them in the water, but lower them into the water and then progress from there. Because they might be able to slide off the chair, do all their exercises, and then get back onto the chair, and then we can lift them out. If they're not able to do stairs, that's a big benefit as well.
Is it hard when you're out in the community? Because I'm sure you see situations where you go, we could just get that person in. I think we could help them. Is that, maybe talk about some of those success stories that you do hear about in that smile, because I think when you do push somebody and they think they can't do it and they've hit that point where they can, and they now are feeling confident and they can go back to that life, it's remarkable. Can you share any of those success stories?
Wow, how many do you want? I know, yeah. I mean, that's the neat thing about PT, is you get to, as I call, jump in their mess with them and help them get back to their, might be a new normal. Wow, I have a patient right now that cannot walk at all. And he is wheelchair bound, and in the future will possibly have a surgery that can help him walk. He walks in the pool. And when he first started, he was on the treadmill, he was holding on for dear life. He would float off the back and have to grab on and pull himself out and hold on to the bars. Now he's doing exercises unsupported in the deep end, so the buoyancy is going to help him, but he can stand by himself now without holding on to anything. So we get to enjoy the little wins all the time, and that's why I love PT, because you're seeing all these little things, and they don't even know a lot of times that they're even progressing. But we're saying, you don't understand. 2 months ago, you couldn't even stand up straight. Now you can. Now you're doing exercises without even holding on to the railing. So that's the patient I have right now.
Wow.
Yeah, pretty neat.
Stacey, how many times have you heard somebody say to you, I should have gotten started sooner?
Oh, a lot of our patients.
Yeah.
Once they get started, once they see that this really does help. And those first few visits are hard because you're asking them to do things that they're not used to, that their muscles are tired, they're sore, they're tight. But then they're able to, after a week, after 2 weeks, they're able to see some of these small gains. And sometimes we have to remind them, those small gains are big. They mean something. And as you keep going, they just keep improving and being able to get to those goals that you set for yourself. So most of our patients are really pleased, and many of them say, yes, I should have done this sooner. If only I would have known this a month ago, a year ago. they are so excited when they leave us and they can do what they want to do.
It's crazy to think when you talked about the journey of physical therapy here and the addition of aquatic therapies. Any idea what's ahead in the next 10, 20 years?
Oh, wow.
That's hard to tell.
4 pools?
It keeps maybe.
I mean, we have talked multiple times. We would love to have an aquatic center that we could discharge our patients to. Because some of them in a truly chronic state, okay, we get them till they're somewhat functional, but in the water, they don't have pain. Out of the water, they do have pain. So if they can exercise or just go walk somewhere in the water, we do send them to the rec complex. Hey, by the way, now the rec complex is a little colder. We have to tell them that, the water. But it's also, there's a lot more programs there that we can send them to. My dream, I would love to have an aquatic center where we could send them to. That'd be great.
So they can just continue to improve and maintain the gains that they have made with us.
Well, we thank you for what you're doing here, and the aquatic therapy offered at Meadville Medical Center sounds amazing. What's the process of getting to your department? Is it just going through their primary care physician? Is it calling your office directly?
The main way is to go through their doctor, their primary care doctor. If it's a surgery, their surgeon. They can refer you to our department.
And again, if it's something they think they're having problems with, they can talk to their doctor about it. Like,
Absolutely.
I think aquatic therapy might be something for me.
Yes.
And then they can pursue it
Absolutely.
that way.
It's definitely at least a good option. Yep.
Okay. Well, you talk about getting people back to living their lives outside of work. What do you do? Stacey, what do you enjoy doing?
Well, I'm a mother of 4, so my children keep me busy. But we like to get out. We like to go bike riding and walking and just have picnics and just get outdoors.
That's great. Mark?
So I'm a soccer referee. And so if people are looking at us like, I know him from somewhere. So yeah, I do that. I also mow a couple lawns in town. And I got grandkids. So between that, I'm pretty full.
Keep you busy.
So absolutely, yeah.
Well, thank you so much for your time. We greatly appreciate all the information, and we hope you learned something as well with Mark and Stacey. So thank you.
You're welcome, Luke. Thank you.
All right, and we thank you for being with us.